So which are the most common digestive diseases that you see amongst Indians?
Oh, so commonly in our practice, very common problems which we see are number one is dyspepsia or acidity, which is very common. Probably that is related to again improper food and the changing lifestyle, because people are not getting time to eat their food properly. They are having too much of mental stress, tension, targets to achieve, because of which the digestion process doesn't happen properly, and they don't get time to eat food, or they gulp their food fast. And so acidity is one common problem, which can also happen because of some ingested bacteria which goes in through the impure food or impure water or uncooked food, and that leads to acidity symptoms. Second common problem which we see is gas bloat, bloating of the tummy. Some people come to me with a lot of burping, incessant burping, especially youngsters, young ladies, young girls, loud burping, their constant burping, or even housewives for that matter. That is one way. Or of course, people who are working in executive positions, they have a lot of bloating type of problem. That means they all the time have a bloated tummy. They always feel full. They are not very satisfied. This is the second problem, is bloat. The third common problem what we see is constipation. See, constipation does not necessarily mean not being able to pass your motions. Constipation means improper motions, going more number of times, or every time you go but you are having an improper, unsatisfactory feeling that you have cleared your bowel properly. Or as the age increases, then the constipation has a different variety. That means they just don't get the urge, what we call bowel inertia. So constipation is very commonly seen in all different age groups, predominantly seen of course in the older age group, but nowadays we are also seeing in the younger age group. I'm getting young patients nowadays, young girls who sometimes don't even pass a proper motion for one week, 5 days. That is also a possibility. That also type of constipation we see.
So what has changed in the Indian diet for acidity to increase, bloating to increase, as well as constipation?
If you ask me personally, one of the common reasons for acidity to increase is timing is not being maintained of the food properly. There is a long gap between two meals, and then one meal that they eat after being very hungry, coming home, they eat until they feel completely full, and then they go off to bed very early after eating the food. Number two is they don't get time to chew their food properly. That means they are just gulping the food fast. So one step of digestion is sort of is bypassed, because mouth and chewing the food itself is an important step of digestion. That is grinding of the food, and it gets mixed with saliva, because saliva contains an enzyme called salivary amylase. So that itself starts your digestion process. So that one step is skipped. Then of course impure food, eating food on the roadside, eating stalls, and another very important is processed and refined food, fast food. That also can cause a lot of acidity and other type of symptoms, because that can lead to again improper digestion, inflammation of the stomach lining, and cause symptoms of acidity. So these are the common causes of acidity.
So when does one need to see a doctor when they have such kind of issues? Because a lot of people think that these are household issues, that, you know, if I have some medicine, if I have something at home, it'll probably get resolved. But a long amount of, or a long phase of acidity can also lead to other digestive diseases eventually. So when does one need to actually see a doctor for these common ailments otherwise?
See, I'll tell you what, if acidity is not getting solved by very simple home remedies or just adjusting your diet properly, all the time you keep on getting tightness in the tummy after eating your food, or you keep on getting reflux, acidity, heartburn, which is happening very frequently, that is a time where it is always better to consult your doctor, because nowadays we do this procedure called endoscopy, by which we look inside the stomach, and we can actually try to diagnose actually what is going wrong there, whether the wall between the food pipe and stomach has become loose like a hiatus hernia that is causing the acid to come up, or whether the lining of the stomach is inflamed. We can diagnose if the person has got H. pylori infection, which is commonly seen, which goes in through impure water or uncooked food. So the point is not that acidity leads to any malignant condition or any condition which is dangerous, but long-standing acidity can be one of the manifestations of early cancers. Early cancer in the stomach, early cancer in the food pipe. You know, there was a study conducted in Japan where they found patients of early gastric cancer and early esophageal cancer, and they were just asking them, what were your symptoms? And 80% of these patients said that I had just acidity, which is now increasing since the last 6 months or so, and it kept on increasing in spite of simple remedies, and this was the symptom. So that is what I say, that if any person has got acidity for a long time, if it is not going off by simple remedies, it is definitely worthwhile consulting your doctor, getting yourself checked up, so that you can at least stem it in its bud and don't allow it to progress, or you can pick up an early cancer for that matter.